Hello, everyone, and welcome to Wellness Woodbridge. My name is Kelly Reedy. I am here with Romeo Bunag and Elvi Bakarico, two nurses from the cardiology department in Raritan Bay Medical Center. Thank you so much for joining us.
Thank you for having us.
Thank you for having us.
Today we're going to be talking about a very important topic, which is heart health. February is Go Red Month, heart health awareness, so it's something that everyone should worry about all year round, but the emphasis is really in February to get your heart checked, know the signs and the symptoms, and any preventative measures you can take to stay healthy. So thank you for joining us.
Thank you.
Pleasure.
Oh, great. I think that we should start with, what is heart disease? What is a heart attack? What is a stroke? So people know what to look for with these kind of things.
One of the important things is that the heart attack and stroke goes hand in hand. If you have a healthy heart, you'll have a healthy brain. And what a heart attack is a lipid deposits or fatty deposits into the coronary artery. And sometimes what happens is that also blood clots form into the artery and blocks the whole portion of the muscle of the heart. And what happened, they became ischemic, they die, and they lose their function. And with stroke, it's the same thing. It's a blood clots that goes into the brain. What happened, the artery into the brain gets blocked up, and the function, you lose certain function, and that's which is controlled by the brain. And there's actually two types of stroke. One we call ischemic stroke, which is a blood clot that goes into the artery in the brain, and the other one is hemorrhagic stroke, meaning there's actually a rupture of the blood vessel into the brain, and that causes a lot of things that kind of blocks the brain cells.
Now, can someone have like a mini stroke and not even realize it till later on, like days later, or is it something immediate where a heart attack you almost feel it?
Oh yeah, because sometimes a mini stroke, it's actually it's a symptoms which is that happens within, I would say, few minutes. Mm-hmm. Usually lasts for about 24 hours, and then afterwards it goes away. But it increases your risk to having another stroke episode, and it's going to be a major stroke. But heart attack, you develop sudden chest pain. There's other symptoms that you can have. I would like to emphasize all these signs and symptoms. One is for heart attack, number one is uncomfortable chest discomfort sometimes. Sometimes you feel squeezing sensation, pain, tightness into the chest, in the middle of the chest usually, and it lasts for about a few minutes, and then after that it goes away, and then it comes back. The other thing is the pain in your jaw, your neck, also in your back, your abdomen, and sometimes even like a toothache. Sometimes it.
Oh, interesting.
Yeah, and then also sometimes you have a shortness of breath, with or without chest pain. And the other symptom sometimes is that you suddenly develop cold sweats, you have a nausea, and then afterwards you get lightheaded. So all those things are the things that for stroke, sometimes you have a sudden, what we call sudden numbness, or sometimes weakness of your face, your arm, your leg, and it's very important to know sometimes it's only one-sided. Okay. The other thing is a sudden confusion. Sometimes you cannot difficulty talking or understanding, and also sometimes you have a difficulty. All of a sudden, you have a difficulty in your balance, difficulty walking, and also difficulty in your coordination. Mm-hmm. And the other things that sometimes we kind of ignore is that you have a sudden headache and without known cause. So that's all the important things that do. And I want to emphasize that it's important to call 911 to make sure that they get medical attention, they go straight to the hospital, because always it's important that we can treat them accordingly, because always we say time is muscle, time is brain.
What is a typical treatment?
The typical treatment that we do, usually if it's a blocked coronary artery, is they go into the cardiac cath lab. We look at it, we look at the blockage, and then we open up with a balloon, we put a stent, and usually also we give them what we call a antiplatelet, which also what happens is it breaks out the clots.
I would like to also introduce like the acronyms of specific signs and symptoms,
yes, mm-hmm.
like with the stroke. The acronym is FAST, F-A-S-T.
Okay.
So if you have a sudden, because that's the easiest way for the public to realize, like,
Oh, yeah.
these acronyms.
That would be great to share.
So FAST, that means F is facial weakness,
Okay.
Or numbness.
or drooping on one side of your face. Then A is for arm weakness on one side, or the strength and weakness.
And
then
you can
S,
see them dripping. You
Yeah,
can
you can-
ask them to raise their arm up, and if it's dripping on one side.
and then and S is for speech difficulty.
Okay.
It's either they cannot talk, like this, or the speech is garbled or slurred and all that.
Or-
and T stands
Yeah.
for
Or ask them also to
smile.
smile, see how
See if the
patient-
difference
yeah.
in the muscle. So
Okay.
one side will droop. And T is time. That means if you see somebody having a stroke or having the symptoms of FAS, you note the time that you call 911 first and make sure of the time, because when the EMS gets there, the time is very important, because that's when you going to be asked when you go to the emergency room, when did the symptoms start, because there is only a certain window that we can give the clot buster that is available out there.
for the stroke.
So
For the
FAST,
stroke.
F-A-S-T.
FAST.
For heart disease, it's basically almost like, the symptoms of chest pain and all that.
Again, it's very important to call 911. Make sure that you don't drive yourself, or because always we tell them time is muscle. Usually we have a timeline. We actually partner with American Heart Association and American College of Cardiology, opening the coronary artery within a matter of 90 minutes. We call it door to balloon.
Okay.
So it's very important to open that blocked artery either in the brain or in the heart, but especially the heart also, because heart feeds the brain and everything goes together. And women also have different symptoms sometimes
Okay.
with chest pain and heart attacks. So just be aware that you don't see the crushing chest pain that guys have, like in the movies, they show all those things. It's not the same. The women sometimes they just have indigestion
Right.
or sudden breakup of
Okay.
sweat. Or sometimes just because I'm 50 years old, I'm 60 years old, maybe I'm just getting tired. But actually it's a sign of a heart attack. You see some fluttering or feeling fluttering on your chest, then that could be a sign. So get yourself to the hospital, or don't drive yourself.
And don't wait.
Don't wait.
So what are some preventative measures or things that people can do within their daily life to kind of prevent heart disease from happening, or just to be the healthiest they can be?
Whatever we hear from the news everywhere that's promoting healthy heart is all about diet. Know your risk factors. Know your risk factors that could cause heart disease and stroke, especially if you have high blood pressure, because high blood pressure is the number one risk factor for stroke.
For stroke.
So we're walking around, nobody knows if you have high blood pressure, so you better get yourself checked.
Okay.
Especially with a medical provider. First, one number doesn't mean you have high blood pressure already, so you need to get monitored. Another one would be
The other one will be, with regards to the blood pressure, they can easily go to like a supermarket or a nearest pharmacy. They have electronic blood pressure machine. They can just go there, have their blood pressure check. And that's very important.
And then eating healthy, of course, maintaining a good healthy weight, and making sure that you know your numbers, meaning your blood pressure must be below 120/80. That's the normal blood pressure, below
Okay.
120/80. Make sure you get your cholesterol checked. Make sure it's below 200, and know the numbers. What is my bad cholesterol and what is my good cholesterol, the LDL and the HDL. It's very important. And know your sugar levels,
Okay.
because diabetes is a big factor in having a stroke and a heart disease. So know your sugar level, and then manage your stress well, eating healthy, of course, low salt, low fat, and all that stuff, and maintain a good weight, because everything flows. You have lower blood pressure if you go and exercise and maintain a healthy
And then
balanced
also
diet.
looking back at the family tree, right? Because we
Right.
discussed before that some of it is
Genetics. Right,
genetics
right.
and
Yeah, yeah.
hereditary. So looking
Right,
to see what
hereditary.
family members have.
And
correct?
also one of the most important things, and it's also preventable, is that smoking.
Okay.
We have to make
Exactly.
sure that our young ones know that, and then instill it into their mind that smoking is not good for their health.
Okay.
And it's not good for their lungs, not good for their heart, for their brain.
And for women too, if you combine smoking and birth control pills, doubles your risk of getting a heart disease and heart attacks.
Okay.
Even at a young age, you can have that because that's very important.
So really instilling these healthy habits with developing a healthy diet, exercising, not smoking when you're younger, as you get older, kind of decreases the risk or keeps you as healthy as as you can be.
And know your family tree, as we say. Anybody that you know in your family, check your mother, your father, your brother, your sister, grandparents. Anybody in the family that had a history of heart disease and had died of heart disease before 55, you got to tell your doctor because it's very important.
So at what age would you say that you should start getting these regular checkups to know your numbers?
For women, it's always been promoted, go healthy, go red, go healthy. For women, it's always like when you're 40, you got to know your risk factors.
Okay.
Where do you lie? Are you on the high risk or in the low risk? Or you know?
And similarly with men, about the age of 40, you want to know, especially if you have a lot of risk factors that will predispose you to heart disease or even a stroke. So that's very important. Get checked, know your risk factors, and that's
and
very
learn
important.
from there because
Also, you can actually go into a website which is the American Heart Association, which will actually identify risk factors, and it will give you a risk scores of your.
So you can just sign in, and then you're going to punch in all your numbers. If you have your cholesterol level, you have your sugar levels, you know your blood pressure, and you know your weight, and what is your BMI and all that stuff, and that it will calculate for you how many percentage of getting the risk of heart attack.
So
and
really
stroke.
knowing your body and taking the initiative to check up on your numbers, check up on yourself, making sure that you're following a healthy lifestyle within every day. February is really when we remind you to do it, but it's something that you should be doing all year round.
All year long,
All year
definitely.
long.
Well, I wanted to thank you guys so much for coming. I think that our viewers are going to learn a lot of different tips about heart health and what to look out for and what they can do to reduce their risk. So I really thank you for coming. It was great.
Thank you.
You're welcome.
We'll be right back.
Today is Saturday. Salad on Saturday, fruit on Friday, throw a ball Thursday. Water Wednesday, touch your toes Tuesday. Let's move Monday, swap us next Sunday.
60 minutes of physical activity a day and eating well can help get your child healthy. So keep them active and eating well every day. Get ideas, get involved, get going at letsmove.gov. That's letsmove.gov.
Hello, everyone. Welcome back to Wellness Woodbridge. Now I have with me Brett Kalish, who is from Wegmans, and sous chef Robert Williams, also from Wegmans. Thank you so much for coming.
Thank you for having us.
Thank you. Thank you very much.
It is great to have you guys here. I personally love Wegmans. We're piggybacking off what the nurses were talking about and the importance of heart health. So what can you guys tell us about a daily lifestyle that is really going to promote heart health, keep you healthy, and your heart strong?
Well, Kelly, as a pharmacist at Wegmans, and all pharmacists, you talk about medicine all the time. Now it's February. It's time for celebrating the heart and what we can do. And like the nurses said, and like you introduced, the more you can do to prevent problems, the healthier you're going to be in the future. So just a few guidelines, things you can do to promote a healthy heart, healthy lifestyle. Number one, obviously, no smoking. We're probably not going to get in litigation trouble by saying smoking is bad. If you smoke, a smoker has about a 6 times greater risk of cardiovascular events, stroke, heart attack, than someone who doesn't smoke.
Okay.
If you stop smoking, within a year that risk is cut in half. Smoking's a big deal. In addition to smoking, physical activity, a regular physical activity. You don't have to be Arnold Schwarzenegger in the gym, but walking every other day. When it gets warmer, it's cold now, it's February, but I usually counsel my patients, if you can walk a half hour a day, not a saunter, but a real walk, get the heart flowing, it's probably all you need to at least start and to get that healthy physical activity, that healthy lifestyle going. And of course, losing weight, having a good BMI, like the nurses talked about. Everyone's aiming for under 25 as a measurement. But you're going to want to increase the good fats, the fishes, things like that, and decrease the bad fats. You're going to want to maybe eat a little less. And we're talking if people can lose 5% of their body weight, which is not a lot. Studies have shown a real increase in basic cardiovascular health. And 5%, if you're a 200-pound man, you're talking 10 pounds.
Yeah.
150-pound, I don't know, woman, say, 7, 8 pounds. It's not a lot to get to that goal.
And the benefits are just...
Benefits are astronomical.
Yeah.
Again, we're talking heart health here. So beyond all the other things, yeah, lower risk of stroke, lower risk of heart attack, any cardiovascular event. It's a dramatic increase. You can do that a lot of different ways. Changing your diet, but also eating less. We talk about sometimes smaller plates. If you look at a plate in this country, it's huge. You look at a plate somewhere else, in another country, they tend not to be as big.
So portion control
Portion control, very important. At Wegmans, we talk about half plate healthy, where half your plate should really be fruits and vegetables. Yeah. Again, not a hard thing to do, but we don't do. We tend to think of vegetables as the side dish, where if you travel maybe to another country, the meat may be the side dish. Maybe turning that polarity around, moving away from a fatty meat to a fish, you know.
So obviously it's important if you are diagnosed or you have suffered a stroke or a heart attack, you really need to make these changes. But it's also important to do it beforehand to prevent it. So really if you can get in these habits, like you said, it eliminates this happening to you.
Sure, and I mean there's some risk factors you can't change.
Yeah.
You can't change age. You are what you are. You can't change...
Heredity is...
Yeah, heredity is
like
big.
The nurses were talking about also.
Yeah, I mean, most of us would like to disassociate ourselves from our family, but you can't. They are what they are, but there are things you can change, and that's really what we try and focus on, and especially here in February.
So what if you get someone that's very, stubborn in their ways and they love their salts and their fatty foods and their steaks? Is there ways that they can substitute and still have the flavor of the food while being healthy and eating healthy?
Well, there's absolutely, but firstly, you don't need to throw all those things away. The key to anything is moderation.
Yes.
So, someone to think I have to go on a diet so all I can eat is, brown rice and plain yogurt, you're not going to stay on that diet very long. It's very obvious. So you can moderate your caloric intake, your fats, your sodiums. But another great way to cut down on your sodium is to build flavors with other things.
Okay.
You can build flavors with hot sauce. Hot sauce is a great way to add a kick of flavor to something before you grab the salt shaker. Lemon, lime juice, things like that. They're going to add flavor without adding calories, without adding the sodium. Brett had also talked about the good cholesterol and the good fats. Through fish, wild salmon has a lot of our omega-3s in it that are shown to help with lowering blood pressure.
Yeah, it's a balancing act. You've got a total cholesterol number, and again, just piggybacking off what the nurses said, you want to keep that under 200.
Knowing your numbers is very important.
And the doctor will tell you maybe he'll want a lower goal, but in general, you're going to want under 200. But then there's the good and the bad cholesterol, and not all cholesterol is bad. There's some cholesterol that will take, the HDL will take the bad cholesterol back out of the body. You want that. And you want a number above 40 or 50 if you're a woman, and the fish will do that. The salmon, these fatty fishes will do that. Just because we say fatty doesn't mean bad. There is good fatty.
Yeah.
So.
Yeah, and the other thing Brett had touched on also is Wegmans promotes the plate with the 3 portions,
right.
where half your plate should be, vegetables, grains, things like that, and those things are easy to do. I mean, we have a lot of grains that are already mixed up for you, and it cooks up really easy. They're very flavorful, and the textures are nice too. So it's not just something mushy. It's just not a mushy vegetable. It's something crunchy. It's something nutty flavored, and it changes things up, because I find that, again, people have the stigma of a diet has to be bland food. It has to be tasteless food, and if you do that, it's not going to work for you. If you change things up, different textures, different flavors, different colors, it's really going to make your diet go a lot easier. It's less like a diet,
So there are a lot of different ways you can incorporate them into your daily diet and not feel like you're dieting, which is really good.
Doesn't have to be an alfalfa sprout.
Yeah.
Exactly. I mean, you could take your yogurt, you can sprinkle some bran into your yogurt, and that adds a little crunch into your yogurt. And again, we're talking about the good cholesterols. Switching to an olive oil, instead of a vegetable oil, instead of sautéing with that and roasting with that, helps. We'll try to avoid the butters and things and still add in a little fat.
Okay. Now, being a pharmacist, are there any medications that people can take to prevent, should they, certain vitamins, things along those lines, or?
We usually recommend omega-3 fatty acids.
Okay.
Again, if you're eating a lot of that in your diet, you may not need it. But, you know, most people don't. So we do recommend that. A regular multivitamin is also a good idea. You know, and beyond that, just being aware of your numbers, knowing what your blood pressure is. If you don't measure it, you really can't do anything about it. It's easier now because most pharmacies, we at Wegmans have a blood pressure machine right there. People can come in anytime. Of course, it's free, and you know, take your blood pressure. We've got little cards that you can record it on a card. And knowing your numbers really makes it so you can do something about it. Knowing that someone cares about it if they want to discuss it with their pharmacist. Just knowing that someone's there to talk about it with you. We've found, and we've done studies in our stores, that people's blood pressures have gone down because they are more aware. And if they're aware, they can do something about it.
Except I think that people generally know the idea of, you know, I got to keep my blood pressure down, but they may not know how to do it or what is low enough, what's too low, and what is too high. So I think to have access to someone like yourself to talk to and to actually be in the store, you can be shopping for all this great food and stop in and get your blood pressure taken right when you're there. It really, you know, makes it a lot easier for the public to go out there and become aware and start to know their numbers, which is great, which is really great.
And if you don't know what to do as far as food goes, you can always go to the chefs there or anyone working in those departments, excuse me, and they can give you ideas on what to do. I mean, we can help you cook things that are healthy. A lot of times, like you said, you don't know what to do.
Yeah.
I want to eat healthy. How do I do it?
Where do I start?
Yeah. Talk to our fishmonger, talk to our sous chef, and get ideas, easy ideas.
Yeah.
I mean, fish is very easy to prepare well.
And then obviously the importance of exercising.
Sure.
Always getting out there and moving, whether it's just walking for a little bit, you know, maybe lifting weights, any cardio, something to get your blood pumping is always very beneficial.
Right.
Which is really great, and you really have to make that a priority, especially as you get older. I think the nurses said the age is pretty much 40, but you can start doing that as early as when you want, right?
So I think it's easier to start when you're younger
if you
and
get
keep it
in,
going than
if you get
until
in,
you're 40.
get in the routine. I know, especially children obesity. If you can kind of get that under control, it eliminates the risk factor earlier on, which I think is a good thing to instill. But like as we mentioned, you do have to keep track of it anyway because of the hereditary factor.
Right.
And
That's
you know,
true.
you speak about child obesity, I think, and talk about prevention also. If you start your children off with these healthy cooking and healthy products and healthy ideas, it's going to be easier for them to maintain that. They're not going to, you know, be like us and try to feed our dog the green beans. You know? If you make them flavorful, and you know, I always say the story of Brussels sprouts. My whole life, I hated Brussels sprouts. They smelled terrible. They were mushy. Well, now that I become a chef, I realize that it's because Mom cooked them wrong. If you can cook them in a way, you roast them with some nice olive oil, some garlic, some fresh herbs, and now they're going to be jumping with flavor. Going to have nice crispy texture, and they're delicious. My children love them, and you know, my son. You would have to pay usually to eat vegetables.
Yep.
So.
And I think that if you instill the habit, you know, cooking with your children, so they see what it's like to cook with fresh vegetables and
get
fruits,
them involved. It's very
and
important.
it becomes a habit, and it doesn't seem like they're eating something like Brussels sprouts. They're eating something delicious, which also has the health benefits, which is the main priority and goal.
And one of the things we did in the springtime at Wegmans is that we started a little garden outside.
Oh, that's
and we
great.
let kids come and plant seeds, and they could take them home with them. And we actually had a garden, and we watered it, so if they came back with their parents, they could see the garden. And that's fun to do with kids also. You tell them, okay, what do you want to plant this summer? And you go outside and you plant those things, and you tell them, okay, we got to water them, you have to pull the weeds, you harvest them, and now let's cook them. And then they're really interested in knowing this is what I did this. And it's, you know, building that healthy attitude from a young age.
No, that's really great. So, you know, February, you always see Go Red. What would you leave our viewers with, you know, words of wisdom from Wegmans to really take care of your heart all year round? I mean, the cooking, the exercise, what would be your...
Make it a habit. Just make good health a habit. Not drastic modifications, but a little different modification all the time toward the healthy side, and it becomes easy. And then it becomes a habit and it stays with you.
Yeah, and mine is don't jump off the deep end. Like, you know, don't just give up all your food and have, you know, brown rice and wheat germ. You know, you vary your diet, you know, with fruits and vegetables and grains and a lot of flavors from spices and herbs. And moderation, you can still eat your fried chicken, just can't eat a bucket full of it, you know, and just, you know, take it slow, like Brett said, you know, instill it.
Yeah.
I guess the facts are there, you know, when you do these things and you cut down on fatty foods and those kind of things, you stop smoking, you exercise, it really does become a lifestyle, which overall benefits, you know, from your heart, which is great. I really want to thank you guys for coming. Brett, Robert, thank you. Everybody, they'll be at
Thanks for having us.
Wegmans if you need any help with anything. It was great to have you guys, and really thank you again.
Thanks, Kelly.
Sure.
Thank you, everyone, for watching. Please keep a lookout for all of the upcoming wellness events. We have a ton of things coming up in the next few months. Our Moves Like Woodbridge campaign will be taking place in March, and look forward to the fun events in the summer months as well. Thank you.